Fibromyalgia is a chronic condition that affects millions of people worldwide. It is characterized by widespread pain and tenderness in the muscles and soft tissues, as well as other symptoms like fatigue, sleep disturbances, and problems with memory and concentration, commonly known as fibro fog. Despite the prevalence of the condition, many people still question whether fibromyalgia is a real condition. However, scientific evidence suggests that it is a real and complex disorder that affects the way the brain and spinal cord process pain signals. In this video, we will discuss the symptoms and causes of fibromyalgia and the available treatment options. We will also examine some of the findings from randomized controlled trials, RCTs, that have been conducted to evaluate the effectiveness of various treatments for fibromyalgia. Is fibromyalgia a real thing? There is still some debate about whether fibromyalgia is a real condition or not. However, scientific research suggests that it is a real and complex disorder that affects the way the brain and spinal cord process pain signals. People with fibromyalgia have abnormal levels of certain chemicals in their brains and spinal cords, including serotonin, dopamine, and norepinephrine, which are involved in regulating pain, mood, and sleep, all of which are affected in people with fibromyalgia. What causes fibromyalgia? The exact cause of fibromyalgia is unknown, but there are several factors that may contribute to its development. These include genetics, trauma, infections, abnormal pain processing, and sleep disturbances. People with fibromyalgia have abnormalities in the way their brains process pain signals, which can lead to increased sensitivity to pain. What are the symptoms of fibromyalgia? The primary symptom of fibromyalgia is widespread pain and tenderness in the muscles and soft tissues. Other common symptoms include sleep disturbances, cognitive difficulties, depression and anxiety, headaches, irritable bowel syndrome, IBS, numbness and tingling. What can be done to treat fibromyalgia? There is no cure for fibromyalgia, but several treatment options are available to help manage its symptoms. These include medications, physical therapy, exercise, relaxation techniques, cognitive behavioral therapy, CBT, and alternative therapies. Medications. Several medications are used to manage the symptoms of fibromyalgia, including antidepressants, tricyclic antidepressants, TCAs, such as amitriptyline and nortriptyline, and selective serotonin reuptake inhibitors, SSRIs, such as fluoxetine and sertraline, are used to reduce pain, improve sleep, and relieve depression and anxiety. Anticonvulsants. Anticonvulsants such as gabapentin and pregabalin are used to reduce pain and improve sleep. Muscle relaxants. Muscle relaxants such as cyclobenzaprine are used to reduce muscle spasms and improve sleep. Physical therapy and exercise. Physical therapy and exercise are important components of fibromyalgia management. Physical therapy may include stretching, massage, and other manual techniques, while exercise may include aerobic exercise, strength training, and flexibility training. Aerobic exercise has been shown to improve cardiovascular health, reduce pain, and improve mood in people with fibromyalgia. Strength training has been shown to improve muscle strength, reduce pain, and improve overall function in people with fibromyalgia. Flexibility training, such as yoga and tai chi, has been shown to reduce pain and improve overall function in people with fibromyalgia. Relaxation techniques. Relaxation techniques, such as deep breathing, meditation, and guided imagery, can help reduce stress and improve sleep in people with fibromyalgia. These techniques can also help reduce pain and improve overall function. Guided imagery, for example, involves visualizing calming and peaceful images, which can help reduce stress and improve sleep quality. Cognitive behavioral therapy. Cognitive behavioral therapy, CBT, is a type of talk therapy that can help people with fibromyalgia manage their symptoms by changing the way they think and behave. CBT can help people with fibromyalgia learn coping skills, improve their self-esteem, and reduce stress and anxiety. Studies have shown that CBT can reduce pain and other symptoms of fibromyalgia, as well as improve overall function and quality of life. Alternative therapies. Alternative therapies, such as acupuncture, massage, and chiropractic care, may also be helpful in managing the symptoms of fibromyalgia. However, the evidence for these therapies is mixed, and more research is needed to determine their effectiveness. Findings from RCTs. RCTs are the gold standard for evaluating the effectiveness of medical treatments. Several RCTs have been conducted to evaluate the effectiveness of various treatments for fibromyalgia. Here are some examples. Cognitive behavioral therapy, CBT. Several RCTs have shown that CBT can be effective in reducing pain, fatigue, and other symptoms of fibromyalgia. A meta-analysis of 29 RCTs found that CBT was more effective than usual care or waitlist control in reducing pain, disability, and psychological distress in people with fibromyalgia. Another meta-analysis of 10 RCTs found that CBT was more effective than pharmacological treatments in reducing pain, fatigue, and sleep disturbances in people with fibromyalgia. Exercise. RCTs have shown that regular exercise can help reduce pain and fatigue and improve overall function in people with fibromyalgia. A meta-analysis of 40 RCTs found that exercise was more effective than usual care or no treatment in reducing pain, fatigue, and improving quality of life in people with fibromyalgia. The meta-analysis also found that a combination of aerobic exercise and resistance training was more effective than either type of exercise alone. Medications. Several medications, including antidepressants and anticonvulsants, have been shown to be effective in reducing pain and other symptoms of fibromyalgia in RCTs. A meta-analysis of 38 RCTs found that antidepressants were more effective than placebo in reducing pain and other symptoms of fibromyalgia. Another meta-analysis of 27 RCTs found that anticonvulsants were more effective than placebo in reducing pain and improving quality of life in people with fibromyalgia. Acupuncture. While the evidence is mixed, some RCTs have suggested that acupuncture may be effective in reducing pain and other symptoms of fibromyalgia. A meta-analysis of 9 RCTs found that acupuncture was more effective than sham acupuncture or no treatment in reducing pain and improving quality of life in people with fibromyalgia. Mind-body therapies. Mind-body therapies, such as yoga, tai chi, and meditation, may also be effective in reducing pain and other symptoms of fibromyalgia. A meta-analysis of 25 RCTs found that mind-body therapies were more effective than usual care or no treatment in reducing pain, fatigue, and sleep disturbances in people with fibromyalgia. If you're interested in learning more about the randomized controlled trials, RCTs, that were discussed in this video, you can find a list of them in the description section below. These studies were conducted to evaluate the effectiveness of various treatments for fibromyalgia, including cognitive behavioral therapy, exercise, medications, acupuncture, and mind-body therapies. RCTs are considered the gold standard for evaluating the effectiveness of medical treatments, and they provide valuable information for healthcare providers and patients alike. If you're interested in learning more about the treatments that have been studied for fibromyalgia, you can find more information by searching online databases such as PubMed, Cochrane Library, and clinicaltrials.gov. Remember, it's always important to consult with your healthcare provider before starting any new treatment for fibromyalgia or any other medical condition. Your healthcare provider can help you determine which treatments are best suited for your individual needs and circumstances. In conclusion, fibromyalgia is a complex disorder that affects millions of people worldwide. While there is no cure for fibromyalgia, several treatment options are available to help manage its symptoms. These treatment options include medications, physical therapy, exercise, relaxation techniques, cognitive behavioral therapy, and alternative therapies. If you found this video informative and helpful, please hit the thumbs up button and consider subscribing to our channel. Your support helps us to continue creating high-quality content and sharing information about important health topics like fibromyalgia. By subscribing to our channel, you'll be notified when we post new videos, so you can stay up to date on the latest information about fibromyalgia and other health conditions. We value your feedback and appreciate your support in helping us to reach a wider audience. Thank you for watching, and we hope to see you again in our future videos.